Hello, welcome to Alacrity Explains Anatomy. Today we're going to be looking at the osteology of the humerus. Osteology of the humerus. So, the humerus is the longest bone of the upper limb. It articulates proximally with the scapula and distally articulates with the radius and ulna, which are the bones of the forearm. Proximally, it articulates with the scapula, and distally, it articulates with radius and ulna. It consists of three parts: a proximal end, a shaft, and a distal end. Proximal end, a shaft, and a distal end. It's important for shoulder and elbow joint movement. Very, very important. Now let's look at the proximal end of the humerus. We have a head. The humerus has a head which articulates with the glenoid cavity of the scapula. We talked about that in the video on the osteology of the scapula. It has an anatomical neck, which is a groove surrounding the head. It has a greater tubercle, has a lesser tubercle. We have the intertubercular groove, which is a groove that allows for the passage of the tendon of the long head of biceps brachii. We have the surgical neck, which is the site for common fracture of the humerus. So if you look at this image, you see we have the intertubercular or the bicipital groove, we have the greater tubercle, the lesser tubercle, the surgical neck, the anatomical neck, and the head. The shaft of the humerus. That's it for the proximal. And now we're looking at the shaft of the humerus. The shaft of the humerus is cylindrical proximally, while it is triangular distally. It has a prominent bony part called the deltoid tuberosity, which is the site of insertion of the deltoid muscle. We also have the radial or spiral groove, which allows for passage of the radial nerve as well as the profunda brachii artery. It has a medial and lateral supracondylar ridges, which are present on the shaft of the humerus. We have the deltoid tuberosity for the attachment of the deltoid muscle. We have the radial or spiral groove, which is posteriorly and allows for passage of the radial nerve and the profunda brachii artery. We have the medial and the lateral supracondylar ridge, which you see in this image, the lateral supracondylar ridge and a medial supracondylar ridge. Now, let's look at the distal end of the humerus. The humerus at the distal end, we have the capitulum, which articulates with the head of radius. Remember, we said distally, the humerus articulates with the radius and the ulna. So specifically, the capitulum of the distal end of the humerus articulates with the head of the radius. The trochlea articulates with the trochlear notch of the what? Of the ulna. We have the medial epicondyle of the humerus. There is a site of attachment for forearm flexor muscles, the muscles that flex the forearm attached at the medial epicondyle, and this is called the common flexor origin. We have the lateral epicondyle, is a site for attachment for the extensor muscles of the forearm, and the lateral epicondyle is called the common extensor origin, just as the medial epicondyle end is called the common flexor origin. So we have the coronoid fossa and the radial fossa, which are located anteriorly in the distal end of the humerus, while we have the olecranon fossa, which is a site for attachment. It attaches with the olecranon process of the ulnar bone. The olecranon process of ulnar bone, while the coronoid and the radial fossas as well. This is the olecranon fossa, is the lateral epicondyle, the medial epicondyle, the head of the radius, the trochlea, the coronoid fossa, the capitulum, and this is the right humerus anterior view, and this is the right humerus posterior view. Muscle attachment. The rotator cuff muscles attach to tubercles. We have muscles called the rotator cuff muscles, which we are going to discuss subsequently in one of our videos. The rotator cuff muscles, they attach to tubercles of the head of the humerus. We have the deltoid muscle, which attaches to the deltoid tuberosity. We have the brachialis muscle that originates from the anterior shaft of the humerus. The brachialis muscle helps in flexion of the elbow joint. We have the triceps brachii muscle that attaches to the posterior surface of the humerus. It's responsible for extension of the forearm. We have the common flexor and common extensor origins, which we said the common flexor origin is the medial epicondyle of the humerus, and the common extensor origin is the lateral epicondyle of the humerus. Ossification of the humerus. At the primary center, which is at the shaft and appears in the 8th fetal week, and we have secondary centers located at the head of the humerus, the greater tubercle, as well as the lesser tubercle. We have distal ossification centers at the distal part of the humerus, at the capitulum, at the trochlea, and the epicondyles, the lateral and medial epicondyles. These ossification centers fusion occur between adolescence and early adulthood. Between adolescence and early adulthood, fusion of these centers start and almost complete. Clinical anatomy. I mentioned earlier that the surgical neck of the humerus is the most commonly fractured part of the humerus, the surgical neck. And around the surgical neck is an important nerve called the axillary nerve. So whenever there's a fracture of the surgical neck, the axillary nerve that supplies the deltoid muscle is affected. When this occurs, there's going to be paralysis of the deltoid muscle as well as the teres minor muscle. Teres minor muscle is also supplied by the axillary nerve. While the mid shaft, for mid shaft fractures, occurs, they may damage the radial nerve. Remember, we said at the radial groove or the spiral groove, we have the radial nerve there, as well as the profunda brachii vessels. Whenever there's a mid shaft fracture, these structures are at risk of injury. We have supracondylar fractures, which are common in children, and the medial epicondyle is vulnerable. It's vulnerable in throwing injuries. Vulnerable in throwing injuries. And you know that behind the medial epicondyle passes the ulnar nerve. The ulnar nerve passes behind the medial epicondyle. So whenever there is a injury to the medial epicondyle or compression of the medial epicondyle, the ulnar nerve is compressed, and this causes a tingling sensation in the fingers of the medial aspect of the hand. This is what we refer to as funny bone. Remember, it is not the medial epicondyle that is the funny bone. It is the ulnar nerve located behind the medial epicondyle that is regarded as the funny bone. Despite the name bone, it is not the medial epicondyle. Thank you for watching. Don't forget to subscribe to Alacrity Explains Anatomy.